Hello, everyone. I'm Dr. Sam Bandularatne. Let's talk about post-traumatic stress disorder, commonly known as PTSD. Many people have heard of PTSD, but not everyone understands what it really is, who it affects, or how it can be treated. PTSD is a mental health condition that can develop after someone experiences or witnesses a traumatic event. A traumatic event is something extremely frightening, shocking, or life-threatening. This might include things like serious accidents, violent assaults, war or combat exposure, natural disasters, or witnessing the death or injury of someone else. It's important to understand that feeling distressed after a traumatic event is normal. Most people will feel anxious, upset, or unable to sleep for a short period afterwards. But with PTSD, these symptoms don't go away. Instead, they continue for more than a month and can start to affect everyday life. PTSD is actually more common than many people realize. Millions of people around the world experience it at some point in their lives. However, not everyone who experiences trauma develops PTSD. Our brains and coping mechanisms respond to trauma differently, and many factors influence whether someone develops the condition. These can include the severity of the trauma, previous life experiences, personal coping mechanisms, and the support someone receives afterwards. PTSD symptoms fall into four main categories. Let's go through them one by one. One of the most recognizable symptoms is reliving the traumatic event. This can happen in several ways: vivid flashbacks, distressing memories, or nightmares about the event. Sometimes these experiences can feel so real that the person feels like the trauma is happening again. Even certain sounds, smells, or places can trigger these memories. People with PTSD often try to avoid anything that reminds them of the trauma. This might mean avoiding certain places, conversations about the event, people connected to the trauma, or even thoughts and emotions linked to it. While avoidance may feel protective in the short term, it can sometimes make recovery harder in the long run. PTSD can also affect how people think and feel. Affected people may develop persistent negative thoughts about themselves or the world, feelings of guilt or shame, difficulty feeling happiness or connection, emotional numbness. Many people say they feel detached from others or unable to experience normal emotions. Another key feature is the body being constantly on high alert. People with PTSD may feel easily startled, tense, or constantly on edge, irritable or angry, unable to concentrate, or unable to sleep properly. This happens because the brain remains in survival mode even when the danger has passed. More often than not, it doesn't occur on its own. It's commonly seen alongside conditions like depression, anxiety, anger issues, or substance misuse. If symptoms like these last longer than a month or start affecting daily life, work, relationships, sleep, or emotional well-being, it's important to seek professional help. PTSD is not a sign of weakness. It is a recognized medical condition and help is available. Many people delay seeking help because they believe they should simply get over it. But the truth is that early support can make a big difference. Can a blood test or scan diagnose PTSD? Nope, not really. Doctors or mental health professionals make the diagnosis by listening to your experiences, discussing symptoms, and using structured questionnaires designed to assess PTSD. The key factor is how the symptoms affect daily functioning and well-being. The encouraging news is that PTSD is treatable, and many people recover with the right support. Treatment usually involves psychological therapy and sometimes medication. The most effective therapies focus on processing the trauma safely and gradually, helping the brain learn that the danger has passed. Two commonly used therapies include trauma-focused cognitive behavioral therapy, eye movement desensitization and reprocessing, often called EMDR. These therapies help people reframe traumatic memories and reduce the emotional intensity attached to them. In some cases, doctors may prescribe medications such as antidepressants to help with symptoms like anxiety, sleep disturbance, or depression. Medication alone usually isn't the main treatment, but it can be helpful alongside psychological therapy. If someone you care about is struggling with PTSD, the most important things you can offer are patience, understanding, and encouragement to seek professional help. Avoid saying things like, just move on, or forget about it. Trauma doesn't work that way. Recovery takes time, but with the right support, improvement is absolutely possible. PTSD is a serious but treatable condition. If you or someone you know is experiencing persistent distress after a traumatic event, please remember, speaking to a GP or mental health professional can be the first step toward recovery. You are not alone, and help is available. Thank you for watching. If you found this video helpful, please like, subscribe, and share so more people can learn about health and well-being and get the support they need. Take care, and I'll see you soon.
Hi, I am Dookie. Please like, comment, and subscribe for more mind-boggling content.